Shalom. We are now standing in the new entrance to the new children's daycare clinic in Shaarei Tzedek. We are very thankful to you, Rabbi Jacob, for your generous donation which enabled us to receive this beautiful new building. And I really would like to take you in and show you our new premises. Please come after me. I would like to show you our new wing. We are now standing in the entrance to the reception. Every family that comes in, they go into the secretary's department and they receive a little map with a route. How do they know where to go? You see these beautiful colors with routes on the floor, and by following the color and the route, they know exactly to which clinic they are invited today.
מרפאות החדשות של בית חולים לילדים, אין ספק שזה צעד גדול עבורנו ועבור ילדי ישראל שיוכלו לקבל עכשיו טיפול באיכות יותר טובה, במקום יותר טוב.
We are now going to follow the light blue line. We are going to see the new cardiology unit, which has just joined us in our new clinic. They used to be upstairs with the adults and didn't enjoy any children habits and stuff. So now they joined us and we're very happy to have them with us. Okay, we've just arrived. We are now going to meet with Dr. Fink, who is the head of the cardiology clinic. As you remember, we have different colors and different routes. We are now going to follow the blue route. The blue route moves us to the surgery department. This department is new to us. It has an ENT department, urology department, orthopedic department, and surgery department. The yellow route we see on our right side leads us to the gastro department and to the endocrinologic department, which is on our right side.
Before coming to Shaarei Tzedek, I worked at Cleveland Clinic, which is one of the most foremost hospitals in the country. And I have to say that I feel like I'm back almost in Cleveland as far as the conditions that we work in right now.
And the emphasis that we put there, in addition really to recruit the best professionals to serve these children, to diagnose them and to treat them, we put an emphasis on a child-friendly environment, and you will see it the minute you enter the floor. And I believe that this was the wish of your parents when they endowed this floor.
We are now going to follow the red route. The red route leads us to the nurses' rooms for checks-up and to the children's daycare department. We are now in the medicine preparation room. You see these two beautiful nurses preparing medicine. This is something new to us because in the old department we didn't have such a room and we used to do everything together on the same surface, which was very difficult. So now we are enjoying very much the special room which you can stay in and quietly prepare medicine without having any other things to do at the same time.
This is the new procedure room, and when I compare it to what we had in the old building, there was really no space to do procedures. Here you have a procedure room which you have a lot of space. I can use the ultrasound. The procedure I do is joint injections, and it's better to do it with ultrasound. In the old building it was impossible to even place the ultrasound, and here it'll be very possible. We have here on the wall we have nitrous gas, which is very good for sedating children. So I think it will be a lot more beneficial both for us, and I think there'll be better results as far as the patient for the procedures that we perform here in this room.
This is the small procedure room which Professor Hashke spoke to you about. This is the room where we're going to do small anesthetic in order that our children will receive the best treatment without any pain.
Some of the really important things that have made it much better for us is that we were on 2 floors before. We were on the 4th floor and the 6th floor, which caused separation between the total care of the patient. Some of our doctors were upstairs, sometimes I was upstairs or we had to go downstairs. So today we're all together. It's a day hospital, it's a clinic, and peritoneal dialysis, which is a kind of dialysis that the kids do at home.
We are now entering a new surgery room. As you can see, everything is already laid out. We have a special bed and special machines for different scopes that we're going to do in this room. We're going to do gastroscopias, bronchoscopias, cystoscopias, and everything is set up to start working here. As you can see, everything is new, everything is still in building, but please God, in 2-3 weeks' time, we are hoping to start to work here. This is our school room where children enjoy the time that they're waiting for the different clinics. If you look at the floor, you can see that there was a lot of work going on here today. They do arts and crafts, they have computers, they have music, they have clowns, very, very many different things to enjoy the time that they spend in the hospital. This is our new vacuum tube, which sends our blood samples all around the hospital, and we don't have to run around doing it anymore. It saves us a lot of very precious time. Good luck. In addition to all the beautiful things we have here, we have a number of clowns who really help us to entertain the children, and not only to entertain, they really help us to do medical stuff so that they take the children's mind out of the pain and makes our work much easier and the child's situation better. The advantage of our clinic is that children do not have to be hospitalized today for many things. They could come to our day clinic, receive blood, receive all kinds of medication which they cannot receive in the community, but receive it during the day, and they don't have to be hospitalized for it. One of the biggest highlights of this new wing, of this new children's daycare hospital in Shaare Zedek, is these beautiful windows. We lived for the last 20 years in a little department without any windows. We didn't see any daylight the whole day. The nurses, the patients, the doctors, the staff, the visitors, everybody are so joyous to see the beautiful light coming in from outside and enjoy the view that we see from our windows.
Today I took a blood pressure of a child, about a year old, and he was getting a little fussy, and then a lady walked by, we could see from the window. I said, "Oh, look at the little lady." And the baby right away looked out the window, and I was able to get his blood pressure without any problems.
Finally, Rabbi Jacob, you can see from a little tour how grateful we are for your generous donation and how well we did with it. And we really hope that this generous donation will help us to give a better, joyous, loving care for all the children of Jerusalem. Thank you very much, and have lots of good health.
It's beautiful, and we're very, very appreciative. And we'll grow into it, and I'm sure it'll be a boon to the children and the families and to the staff.
Rabbi Friedman, I would like to thank you very much for your kind contribution for making this miracle happen. We moved here a week ago and started seeing our patients here. It's a real change for the life of the children.
אני מרגישה שהרבה יותר כיף כאן, ויותר טוב כאן, יותר מרווח כאן, ויותר כיף לי לקבל את הטיפול כאן.
On behalf of all the Pediatric Gastroenterology Institute, I would like to thank you so much for making this happen.
The huge difference compared to the conditions that they used to have, and I think the patients are a lot happier to come to the new wing.
I'd like to thank the Friedman family for their generous donation for our new department. It's beautiful.
לבית חולים שער יש עכשיו בית חולים לילדים ברמה בינלאומית, עולמית. מי שצריך את עזרתנו מקבל פה את הטיפול המרבי ואולי הכי טוב בעולם.
Everything is new, and of course care is improved a lot since we have moved into this new wing.
Many of our patients come to the hospital and say, this is our home, our second home. They are happy to come, and they are glad to stay here, and it's thanks to all your vision and donation. Thank you very much.